Part 4, horrible to optimal, my menopause journey. Doctor number 3, I had high hopes for because I found a functional medicine doctor who specialized in women's hormones. So I was super excited. She had a subscription-based service that was expensive, but she was saying a lot of the right things in alignment with my functional medicine beliefs, so I agreed. But before we could get started, she said she wanted a few extra labs done that weren't included in my annual lab work or my ZRT hormone testing. So she sent in my lab order and I went to get my blood drawn. Thank God that phlebotomist spoke up. She verified that I was self-paying and then asked if I was aware of how much it was going to cost. Now I said no, but it was only a couple of tests. So she turns her computer screen to me and said, "Did you know it was going to be this much?" Now, there was a long list of tests, and at the bottom, the total was almost $2,000. I was absolutely floored. The doctor had basically just sent over the full range of tests, most of it which I'd already done, plus a handful that had absolutely nothing to do with hormones. So I don't know if that was supposed to be for someone else or what. Again, she told me I only needed a couple. So maybe an innocent mistake, but I would have been financially responsible for that. And based on her defensiveness when I called her about it, she would not have taken responsibility for the mistake. It also took weeks to get a partial refund for the subscription service that I had paid for that she actually hadn't done anything to help me yet. Okay, and please know that it hurts me to even tell you that little story because I 100% believe in functional medicine and what it can do to change lives. But it needs to be said that it's a very popular specialty right now, and it's also generally accepted that functional medicine doctors cost a lot of money because they can't take insurance. And that's because insurance dictates care. They won't cover a 30-minute to an hour appointment time, but this also means on the flip side that some shady doctors may jump on the bandwagon of functional medicine with very little training, charge a bunch of money, run a bunch of expensive tests, and then just basically treat you in a conventional way. I don't know what kind of results that doctor normally gets for her patients, but based on how defensive she was with me, I think she wasn't used to having a patient who was trained in functional medicine as well and could question specific points when I thought she was BSing me. Okay, so functional medicine, yes, but get a referral from someone you know. Don't go in blind like I did. I was naive. Please don't waste your money. Okay, the next video will be the last few doctors and how I was gaslit.